all of you again virtually. I will call this meeting to order as meeting number 13 of the Standing Committee of Government Operations and Estimates. A couple of notes before we begin. In the second hour of today's meeting, we will only have one witness. That is a representative from the Canadian Union of Postal Workers. So I would like to take 15 minutes at the end of that meeting to discuss future business and more precisely future witnesses. For the purposes of this meeting, we have representatives from the Minister's Office. Minister Haidu is here, with also representatives from the Public Health Agency of Canada. And we will begin by asking the Minister to give a short statement of no more than 5 minutes, followed by our normal round of questions. Since we're starting on time today, which is somewhat unusual, we'll go to our normal rotation of 6 minutes, 5 minutes, and then 2.5 minutes for the first round. For the witnesses, Minister and all witnesses, I would ask when you are speaking, if you could please speak in one language as opposed to alternating between French and English. It would assist our technicians greatly. So in other words, if you start speaking in English with your statement, if you could maintain that language for the entire duration of your statement or question, I would appreciate it greatly. And with those few words, I would like to invite Minister Haidu to give her opening statement. Minister, the floor is yours.
Well, thank you very much, Mr. Chair. And at your request, I will keep my remarks in English. Mr. Chair, honorable members, thank you very much for this opportunity to speak to the committee today about the health portfolio's role in the government's response to COVID-19. The scope of COVID-19 has left no country untouched. And tragically, this pandemic has claimed thousands of lives worldwide, and Canada has not been immune. My heart goes out to all those who have lost a loved one here in Canada or around the world. During this unprecedented crisis, Canada has worked together to protect our healthcare systems and avoid the surges that have led to even greater loss of life in other countries. And we must continue to work together to ensure our health systems are fully prepared to care for Canadians as the world strives to find treatments and a vaccine. And to do so effectively, we are working with provinces and territories to identify their needs and help purchase required equipment, supplies, and services. We've taken an aggressive approach to buying, especially when it comes to personal protective equipment for frontline healthcare workers. This includes ordering in bulk on behalf of provinces and territories, supplementing these orders by purchasing everything immediately available that meets requirements, and galvanizing Canadian industries to increase domestic manufacturing capacity. These measures are over and above what the provinces and territories are doing in their own right to secure their own supplies. The government is also coordinating shipments of supplies from other countries. Canada has established an on-the-ground support in China for transportation, receiving, storage services, and customs clearances. And Canada is receiving shipments, and the government is working rapidly to distribute personal protective equipment and medical supplies to provinces and territories using an approach agreed upon by federal, provincial, territorial ministers of health. Provinces are proactively allocated 80% of the shipments on a per capita basis, while 20% is held back for the National Emergency Strategic Stockpile. This holdback is used to fulfill urgent requests for assistance from provinces and territories. Furthermore, we know that early diagnosis is essential to slowing the spread of COVID-19 in Canada. And that's why in March, I signed an interim order to allow expedited access to COVID-19 related medical devices, including diagnostic test kits. An interim order is one of the fastest mechanisms the government can use to help make health products available to address larger scale public health emergencies. And to date, we've authorized 19 tests under this interim order, tools that are necessary for our response to this pandemic. The interim order also ensures that other COVID-19 related medical devices are available to treat, mitigate, or prevent this disease. To help do this, the order allows Health Canada to review approvals granted by other countries when deciding whether to authorize a device for importation or sale. It also waives all application fees for COVID-19 related medical devices, further removing impediments for manufacturers in this time of health need. Mr. Chair, the health portfolio in particular, through the dedication of officials at the Public Health Agency of Canada, Health Canada, the Canadian Food Inspection Agency, and the Canadian Institutes of Health Research, is committed to doing everything it can to protect the health and well-being of all Canadians. And I'd like to conclude by thanking all of you, honorable members, for your ongoing work, collaboration, and support to your constituents during this difficult time. Together, we will continue to do everything we can to ensure that our country's response continues to be effective and that we are equipped into the future. Thank you.
Thank you, Minister. We'll now start with our 6-minute rounds of interventions, starting with Mrs. Block for 6 minutes. Mrs. Block, if you could unmute your microphone, please.
Thank you very much, Mr. Chair, and I would like to thank the Minister and the many departmental officials she has with her there for joining us today. I'm going to try and keep my questions really succinct so that I can get as many in as possible, and I would appreciate the same back in the answers that are provided where possible. Minister, have any substandard N95 or KN95 masks been recalled in Canada?
Yes, there have been substandard masks that have been distributed through other suppliers that have been advised to be deficient and not meeting public health standards.
So it's my understanding that the government of the Northwest Territories is recalling defective KN95 masks. Did these come from supplies purchased by the federal government?
No, they did not.
Okay, well then they must have come from a supplier which the government of the Northwest Territories purchased based on a medical device establishment license granted to a supplier by your department. What is the name of the company that held the MDL which sold the masks to the government of the Northwest Territories?
I don't have that precise name. I don't know if officials know the name of the distributor. We can follow up.
Thank you very much for that. Of the approximate 59 manufacturers impacted by your department's recall of KN95, so far only one MDEL holder has initiated a recall. Do you expect any more recalls? And if you do, how many?
I'll turn to Deputy Lucas, who is monitoring the situation.
So indeed, on May 9th, Health Canada canceled the authorization for importation and sale of a KN95 respirator. And in addition, have contacted a number of other MDL holders to change the labeling, which does represent a recall in the definition we use to indicate that they don't meet the N95 filtration standards, but relabeled could be used as face masks. And that process has happened, and we issued on May 11th a public advisory to that end, in addition to contacting those medical device establishment license holders.
Thank you. Thank you very much. Does the department track the use of MDLs?
We have the information on the MDLs. We ensure that the information provided is accurate in terms of their use. That is done. They're utilized at the provincial level or local level, further to the guidance and conditions of use that represent their authorization.
Okay, is there any department that would track importations as a result of the use of the MDL?
The medical device establishment license is issued to enable either manufacture here or importation. So we have the information, and I believe the Canada Border Services Agency has it in regard to the import of those products.
I'd like to, does the Public Health Agency of Canada have a role to play in the recall of contaminated supplies?
No, in regard to the regulatory authorization issued by Health Canada, we are the authority that then issues recalls or instruction to manufacturers or to medical device establishment holders to change their labeling, as was done in the case of 20 or so MDL holders associated with the KN95 masks that didn't meet the NIOSH standard.
Thank you. Thank you very much. Minister, personal protective equipment made by the Guangdong Golden Leaves Technology Development Company has been delisted by the CDC. Why is this company allowed to sell PPE in Canada? Or why have they been?
Thanks to the member. I'll have to follow up on that question.
Okay, Chair, do I have any more time?
You've got a little bit of time, Mrs. Block, another minute or so.
Okay, so almost 60 companies are on the recall list for KN95 masks. How can this many companies be approved to sell masks in the first place?
These are companies that had achieved a medical device establishment license on the basis of meeting Canadian or equivalent standards. The further assessment that was done initially in the United States enabled the determination that they didn't meet the N95 standard, and as a consequence, the information through the public advisory and direct contact with the companies was issued on a expedited basis on May 10th and 11th.
Thank you very much, Mr. Chair. I'm hoping that we will receive the responses to the questions that they were not able to answer here today in a timely manner. Thank you.
Yes, Mrs. Block. As you know, I always advise the witnesses to please provide their answers that they were not able to provide verbally in writing to our clerk at their very earliest opportunity. Now we'll go to Mr. Drouin for 6 minutes, please.
Thank you, Mr. Chair, and thank you, Minister, for coming in front of this committee, and as well the staff that is here with us today. And I actually want to take this opportunity to thank all the frontline healthcare workers, and also thank your department and the staff that have been working, I know, 24/7 on this particular issue. We are living in unprecedented times, and I know we're on the subject of personal protective equipment and discussing other medical supplies. And I'm wondering, Minister, if you could explain to us what the role of your department is, and how are you working with provinces to ensure that we do get personal protective equipment to our frontline healthcare workers?
Well, thank you very much for the question, and through the chair, the department is working full steam on both procuring in partnership with Procurement Canada, and also in supporting, as you heard earlier, licensing for new products, either developed here or new products that are available in markets elsewhere. I think the important piece of work that happened early on was developing a framework for how we would actually allocate personal protective equipment across the country in a timely way, and ensuring that we had a distribution mechanism as well to get PPE to provinces and territories quickly and fairly, allowing us, of course, to hold back the 20% so that we could have emergency supplies if there was a surge in any particular jurisdiction. That formula has worked very well. I have regular meetings with my provincial counterparts each week, and one of the issues we talk about is PPE, and of the requests that have come forward, we have been able to fill almost all of them. There are some new ones, as always happens, but generally speaking, people are satisfied with how the sharing agreement is unfolding.
Thank you, Minister, for that response. The other issue we're often hearing in the news is testing and ramping up testing for COVID-19 tests. And I'm wondering, what is the role that your department is playing in this? And I'm assuming to help provinces ramp up capacity. Is there any new information you could give to this committee?
Thank you very much. And as the member is fully aware, testing is one of the important and integral components to resuming a new normal. And so at the federal level, we see ourselves as building capacity for all the provinces and territories to test to their fullest need. So we've been actively engaged with provinces and territories, first of all, in ensuring they have testing approaches that work for them, the equipment, the reagent, the swabs that go along with the particular approach they've chosen, including offering human resources where necessary for the contact tracing that goes along with the testing. We continually have conversations with provinces and territories on additional needs they might need to reach their own particular targets. Each province and territory has their own testing approach and strategy, and so we work within the framework of the province that is asking for that support.
Thank you, Mr. Chair. How much time do I have left?
You've got about 2.5 minutes.
Great. Minister, we know that, obviously every country is trying to work on the vaccine, and ramping up the research capacity is important. What has Canada done in terms of trying to help ramping up research capacity in Canada?
Well, thank you very much. And as the speaker knows, in our last mandate, in fact, reinvesting in research and science was one of the pillars of our approach to getting Canada ready for all kinds of things that we would face in the future. And thankfully, that investment has been something that's allowed us to build on. We've invested just over $158 million in COVID-19 research through the Canadian Institute of Health Research. Dr. Strong is here with us today and has had an active role in ensuring that money gets out quickly. In fact, I want to thank the research community, the academic community, for coming together to do the peer review necessary to ensure that quality research projects were selected to fund. And in fact, this work began in early March. And so I'm very excited to say that the research is ongoing. It's a blend of scientific research on the virus itself and also on some of the other impacts on Canadians as a result of living through a pandemic, as well as behavioral insights that will help us to support Canadians into the future.
Thank you, Minister. And I believe you said Dr. Strong is with you today.
Yes.
Yeah, and is there? And if I can ask the question to Dr. Strong, would he be available to describe the collaboration that is happening with the research community to ensure that we get to that vaccine as quickly as possible?
And I know it's a tough one to answer briefly, Doctor, but if I would appreciate a brief answer if you possibly can.
Thank you very much for that. I will be very brief on. There is tremendous collaboration, not only across the various agencies within the government itself, so NRC, ourselves, Health Canada, PHAC, as we look at each of these vaccines or approaches, but across Canada, it is a very integrated network of researchers that are bringing together the expertise necessary for this, and very strong international linkages as well. So a tremendous effort on all fronts.
Thank you very much. We will now go to Madame Vignola. 6 minutes, s'il vous plaît.
Merci beaucoup, Monsieur le Président.
Thank you, Mr. Chair. So my question concerns the study of the Public Health Agency concerning the process for RNSU. I would like to know if there are provincial or territorial interveners that were consulted and what were their conclusions about the NES, the National Emergency Strategic Stockpile.
Could you just repeat the first part? I'm sorry.
No problem. There was a study of the PHAC on the processes of NESS. So I was wondering, what were the provincial and territorial interveners that were consulted and what were their conclusions regarding the optimization of the process?
Okay, thank you. I will turn to my officials to answer the question. Dr. Namastiansky.
Thank you. Thank you, Mr. Chair. So I'm not certain which study is being referred to, but we've had a couple of examinations of the nests. So I was wondering if there could be a little bit more precision around which study is being referenced.
Yes, briefly. I'm talking about the ministerial reports of 2018-19 of PHAC. We've worked to optimize the results of NESS to support the modernization of processes and contents about procurement for medication or medical countermeasures. So who were the provincial and territorial interveners in these optimizations of processes that were consulted, and what were their conclusions?
I think, Mr. Chair, we'll have to do some analysis and get back to provide the committee with some additional detail further to the question that's being asked.
Merci. Donc,
so on April 24th, the Minister for Procurement said to the committee that the PHAC was distributing medical supplies according to a formula negotiated with the provinces based on 80-20% sharing. Could we have more details about that formula, please?
Formula is as you described. As we receive personal protective equipment in a variety of categories, the equipment is distributed based on an 80-20 formula, meaning that, and by capita, meaning that provinces get an allotment based on their population, and 20% of the deliveries are held back by Public Health Agency of Canada, so that we have them in case any other particular region in Canada experiences a sudden surge, and we have the capacity to then support that region. This was agreed upon by all provinces and territories.
OK. C'est bon.
So to be clear, let's say that we have 100 supplies or masks per capita in one province or territory. It will get 80, and the 20% remaining will be saved by the federal government to face emergencies or surges there or elsewhere. Is that it?
Masks received, then 80 masks would be distributed across the country to the provinces and territories, depending on their population. If they had a very small population, they might get 5 masks. If they had a very large population, they might get more. And then 20 of those masks would be stored, yes, in the National Emergency Stockpile for the potential of an outbreak in another part of the country.
Merci.
Thank you. I'd like to get back to the order of March 18th, that accelerates the process for authorizations and that make more flexible some regulatory requirements. So following that, did you have any concerns regarding the safety of some medical devices that were received? And if so, which ones, and what were the causes of those concerns?
In a short answer, no. In terms of personal protective equipment, unless it's coming from an approved vendor that we've worked with before, all items are tested. And for Health Canada, they work very, very carefully to ensure the safety of all equipment and review the approvals from other countries.
Thank you very much. We'll now go to Mr. Green for 6 minutes, please.
Thank you very much, Mr. Chair. Is Dr. Tam within that room?
Yes, she is.
Thank you very much, Mr. Speaker. Before I begin my remarks, and I'm going to put some very direct questions to this committee, I want to make a personal statement to Dr. Tam that the public comments that were made to you that cast negative aspersions on your professionalism and loyalty were racist in both their intent and their impact. And I believe that they contributed to xenophobic attacks across the country. And for that, I wanted to make sure that I went on the public record today to say how deeply sorry I am that you had to experience all of that. And now on to the direct questions. I will ask that there also be a direct response through you, Mr. Chair, to the Honourable Minister. Did the Public Health Agency of Canada warn the federal cabinet at any time in the last decade that the National Emergency Strategic Stockpile was not funded or mandated to amass sufficient levels of medical supplies and equipment to respond to a pandemic like COVID-19?
Well, thank you. And through the chair, I'll just say that I've only, before the pandemic outbreak, I had been the minister for a month and a half. So I was just in the process of learning about all the agencies that I would then have the responsibility for. But I will say that the agency has been extremely responsive in terms of indicating to multiple governments the needs in which they have. In fact, the agency was actually working on renewing and looking at its.
Honourable Minister, if I can ask directly, were you a minister prior to becoming the Minister of Health?
Yes, I was.
Were you ever briefed at the federal cabinet at any time in the last decade that the National Emergency Strategic Stockpile was not funded or mandated to amass sufficient levels of medical supplies or equipment to respond to a pandemic like COVID-19?
Well, I can't speak to the 5 years prior to our government, where in fact under the Harper Conservatives, the agencies experienced significant cuts. But I can tell you that during the 5 years that we were in government, in fact, we increased funding to Public Health Agency of Canada. In 2014-15, the funding was $637 million. We increased that funding by 6%. In 2018-19, PHAC's funding was $675.4 million. I say this because that's actually the nature of how these conversations happen at the cabinet. It is rare that a minister would come forward with a specific request about a specific item line, but rather submit those budget proposals to, as you know, the finance minister, and work directly with the finance minister unless it was changing a program in its specific nature.
If I may refresh your memory, on April 1st, 2020, in a news conference, you admitted that the federal government likely did not have enough protective equipment in the National Emergency Strategic Stockpile to meet the needs of this pandemic by saying we likely did not have enough. I think federal governments for decades have been underfunding things like public health preparedness. In your view, has the National Emergency Stockpile been underfunded for decades?
I think I'll just refer to my quote. I do believe that public health has been underfunded for decades. I do believe that we don't spend enough money on prevention, and that would include preparedness. So I stand by that statement, but I also understand that the National Emergency Stockpile was actually never meant to accumulate personal protective equipment, but rather other kinds of treatments for all kinds of biological events.
I'm still, unfortunately, unwilling to accept that as an answer, but I will go on. The Public Health Agency of Canada whistleblowers recently informed the Globe and Mail that PHAC did not have a target for the levels of personal protective equipment that it should maintain in the emergency stockpile. It didn't know the levels that the provinces and territory stockpile had, and it did not advise other levels of government about how much should be stockpiled. Dr. Tam, as the Chief Public Health Officer, were you aware of this situation prior to the COVID-19? And if not, why not?
So I think in terms of personal protective equipment, that wasn't the main focus of the stockpile. It was to look at some very unique countermeasures like smallpox vaccines and other anthrax and other aspects. So in the pandemic preparedness construct, the provinces and territories also have their own stockpiles, and that they have their own personal protective equipment because they use that all the time. There was definitely a small amount. It wasn't a lot that can potentially help in a very specific situation, but that was not the main focus of MES. And I'm sure that we'll learn lessons, and I think people can decide what should be in the nest going forwards.
So Dr. Tam, when I asked Ms. Thornton to provide this committee with the current state of the nest stockpile, given the news reports of the closure of the Regina warehouse and the discarding of millions of critical PPEs leading into COVID, she responded that she didn't have the critical information available, despite having previously asserted in her testimony before this committee that her department had sound logical systems in place. For that information gap worries me. So as Canada's medical health officer, are you aware of how many PPEs had been discarded in the shutdown of the 3 of our previous 11 emergency stockpile locations?
Unfortunately, Dr. Tam, we're completely out of time, but I would ask, as I have with other witnesses, if you could provide a very fulsome answer to Mr. Green's questions in writing as soon as possible directly to our clerk. And with that, we will now go to our next round of 5-minute interventions, starting with Mr. Abultif.
Good morning, Minister, and to your team too, and welcome this morning. The question is, many of the KN95 masks in Canada or on Canada's recall list were tested by the CDC as early as April 13th, with filtration rate as low as 20%, which is significantly lower than Canada's 95% requirement. The question is, why did we okay these suppliers?
We became aware of the U.S. FDA's revised guidance on May 7th and acted rapidly to assess that, and issued on May 10th. Contacted the medical device establishment holders to indicate that the labeling needed to be changed, issued a public advisory on May 11th, and on May 9th canceled the authorization to one company in regard to the KN95 mask. So that's the chronology of our work.
So the 3 of the suppliers that were found on this, they were found to counterfeit by CDC. So can you name those 3 suppliers?
I don't have the specific supplier names here. When information comes to us on false or misleading claims or counterfeit materials, our compliance and enforcement officers work on it immediately and take appropriate action, including referral to law enforcement officers.
So as if I understand correctly from your answer, that basically you don't know the names of these 3 suppliers, and there could be more out there. So how are we tracking, or how are you tracking those counterfeit PPEs?
So that's not what I said. What I said is, as information comes to our knowledge, be it from information in Canada or from another country, we act on it immediately in terms of identifying the supplier, issuing the appropriate compliance and enforcement action, and if there's non-compliance, referring it to law enforcement officers. In terms of specific company names, I will follow up with our compliance and enforcement organization to provide that information if it's in the public domain.
So what is the difference between not approving PPE and recalling it? Can you explain that process, please?
We authorize medical devices, including personal protective equipment, based on our assessment or in reference to an evaluation of assessments granted by other regulatory authorities in whom we have confidence. Certainly in the Government of Canada's procurement, we test the materials to ensure that they meet standards. If information comes to our attention of products for which a medical device establishment license has been issued, we act on it immediately, as was done in the case following the U.S. FDA revised guidance being provided on May 7th.
Is there any non-medical masks being sold to the federal government and being distributed across the country as medical grade equipment?
No, well, I mean, we'll check with procurement in terms of what they have ordered in terms of non-medical equipment, but through my department, the realm that we work in is medical equipment, and anything that's distributed through the Public Health Agency of Canada to provinces and territories has been thoroughly tested or is from a trusted supplier.
A relabeling was mentioned by one of your officials there. Are you aware of relabeling from non-medical equipment to medical equipment? Are you aware of that process within your department, Minister? Yes or no?
Perhaps, Mr. Chair, I could speak to that issue. That may be a reference being made to equipment that is coming from China. And in terms of whether or not companies in China have a medical license that has been granted by the Chinese authorities or not. So that could be in reference to that, question.
So there was some relabeling happening to non-medical product as medical product and being distributed across the country by Health Canada. Is that correct?
No, that is
not correct.
Are you sure?
In terms of Health Canada's role as a regulatory authority, we would not issue guidance to have non-medical masks relabeled as medical, and should information that is occurring come to our attention, we would ensure appropriate compliance enforcement action is taken immediately.
One of those factories in China are listed under your the supply list, our suppliers under Health Canada, and they've been approved. Some of them, they're being flagged because of the quality of their product. And in reference to that, the question again, are you aware of relabeling non-medical products as medical products?
In answer to the question, everything that we receive through the Public Health Agency of Canada that's redistributed to provinces and territories goes through a verification check of its safety and quality here in Canada.
Thank you very much. I'm sorry, we're completely out of time. We will now go to Mr. Weiler for 6 minutes, please.
Thank you, Mr. Chair. And I'd also like to thank all the witnesses for joining our committee today. I, like all Canadians, are very grateful for the work that you're doing in collaboration with provincial counterparts to help navigate us through this crisis. And I'd also be remiss not to thank all of Canada's healthcare workers and all the work that they're doing to keep Canadians healthy and to slow the spread of COVID-19. Along with testing, we know that contact tracing is important to get through this pandemic. And Minister, how is the Government of Canada working with the provinces and territories to get stronger contact tracing done in Canada?
Thank you very much for the question. We know that contact tracing, you're absolutely right, is a critical component. It's not just enough to test someone. In fact, when they are positive, then you have to figure out who they've had close contact with to stop the spread of disease. And so we know that contact tracing is time consuming and laborious, and many public health units are working flat out to do as best as they can. So at the Government of Canada level, we have reinforced the capacity of provinces and territories to do contact tracing by training the government workers and Statistics Canada to support provinces and territories to do that work. In fact, that is being utilized in Ontario and I believe Quebec. And so we will continue to offer that support to provinces and territories. It is an incredibly important component of stopping outbreaks.
And Minister, you mentioned some of the research being done and the $158 million that's been invested in that regard. But I'm wondering, how is Health Canada and how is the Health Canada working with other departments within the federal government on both the research of vaccines and treatments of COVID-19?
Thank you. I'll give a few brief comments and I'll turn to the deputy, but we are working with many, many departments, but most profoundly innovation, science, economic development on both the research and development of products and equipment that can be sourced and created in Canada, but also on vaccine development and therapeutics. So I'll turn to Deputy Lucas to speak a few words about that.
So indeed, Building on Minister Haidu's comments, Health Canada and the Public Health Agency are working with Innovation, Science and Economic Development Canada, the National Research Council, and other partners to not only do the fundamental research, as Dr. Strong spoke to, through the Canadian Institutes of Health Research, but work to build the manufacturing capacity in Canada to enable that. And indeed, there have been over $1 billion announced in funding and in investments made in companies to support the development of candidate treatments and vaccines.
Great. Next question here, and I ask this because I know that there's at least 5 distilleries in my riding that are producing hand sanitizer. What work has Health Canada done to get products like hand sanitizers to market faster to address COVID-19, while at the same time protecting the health and safety of Canadians?
Thank you for the question, and I think I'd like to thank the officials at Health Canada and PHAC for working so hard during this pandemic to accelerate processes that sometimes took much longer. In fact, as of May 16th, Health Canada has authorized 80 disinfectants, 2,200 new hand sanitizer products, and almost over 1,500 new site licenses for over-the-counter drugs and natural health products. And so you can see the speed at which the department is working to ensure that those Canadian companies that are stepping up to be part of the solution, whether it is in products or medical devices, have answers quickly. And finally, I'll just say the department also works very closely with these manufacturers and developers to make sure that their product actually can receive Health Canada approval. Sometimes it can be a tweak or in a process or a slight change to the formulation, but Health Canada has been extremely hardworking to ensure that these hardworking Canadian companies have the support they need to have success on the licensing end.
Thank you. And Mr. Chair, how much longer do I have?
And what is the name of your riding, Mr. Weiler?
West Vancouver, Sunshine Coast, Sea to Sky Country.
And we're completely out of time. Now we'll go to Mr. McCauley for 5 minutes, please.
Thank you, Mr. Chair. Minister, I just want to start with your comment about blaming the Harper Conservatives. First of all, I want to say how disappointed I am that instead of dealing with this very important situation, that you use that disgraceful fallback line. I have the public accounts with me because I keep them everywhere I go. And in fact, since the Liberal government came into power, the first year in power, you cut PHAC funding 10%, then 13%. Overall drop of 5%. Public or health ministry in total was slashed 12% since the Harper years. So I would ask that you would actually focus on providing true answers to this committee about this pandemic rather than falling back on disgraceful Liberal talking points about Harper cuts. Now I want to get to my questions. Many of the N95 masks, on a recall list were tested by CDC as early as mid-April, with filtration rates as low as 12%. Now, why did we okay these suppliers? Now, these were, again, banned in the States because of faulty masks, notified by CDC a month ago. Why are they still being allowed into Canada?
Mr. Chair, as I'd indicated, Health Canada became aware of the US FDA issued revised guidance on May 7th after they
Okay, let me stop right there. Why does it take you so long to be aware of that when it's published April 13th? I can find it on Google. My staff did. Why does it take us so long?
The information provided to us through the testing undertaken and the revised guidance in terms of the utilization of the mask was completed on May 7th. We looked at the work done by the National Institute of Occupational Health and Safety, identified
I had those documents and it shows as early as middle April. I have those documents as well from NOISH. They show mid-April that they did the testing and published it. Why does it take us so long? Are we waiting? Are Are we waiting?
We work with the United
to hear
States
from them?
Food and Drug Administration, who, Mr. Chair, we worked with the United States Food and Drug Administration, who issued their revised guidance in regard to those masks on May 7th.
Okay.
With that information on May 9th, canceled the authorization for a company pertaining to KN95. On May 10th, issued letters to medical device establishment holders requesting that the
Are we
products be,
waiting for them to
relabeled.
contact us with this, or are we not proactively looking at their website or watching this? Because again, we've seen, like, we've looked at all the companies that had the recalls or were banned in the States. April 13th, April 15th, April 20th, the information was available. Are we just sitting back and waiting for CDC to give us this information?
Mr. Chair, we are actively looking at sources of information that pertains to the quality of products on the market and working with other regulators, including the United States Food and Drug Administration, to act on that basis, which is what we did in this circumstance.
And I will just say now we are required, I'll also say, well, we're also requiring independent testing data now for new KN95 approvals from Health Canada so that we can ensure that we have our own independent testing data.
Okay. On the Healthy Canada's website, we're listed, the recalls are listed as an advisory, but the title and description on the website says it's a recall. Why do you recall, or why do you classify the recall as merely an advisory?
Mr. Chair, in this circumstance, the specific regulatory action for those 20 or so companies was to indicate that they needed to relabel the medical devices, which could still be used, but not in the circumstance where an N95 level of filtration was needed. That relabeling is formally considered as a recall, but the specific regulatory action requested was to label in accordance with Health Canada direction to ensure that they're used in an appropriate way.
Let me ask you, the 11 million masks that the N95s have come in so far, about 9 million, give or take, have been found faulty, substandard, or substandard, poor filtration. We've heard they could be or used otherwise for perhaps surgical masks or other issues. Who's deciding what they can actually be used for? We've heard conflicting information from Minister.
I'm afraid we are completely out of time for that question,
Thank
but
you.
I would appreciate if you could once again provide an answer to Mr. McCauley's question in writing to our clerk and as quickly as possible. We'll now go to our last 5-minute intervention, and this comes from Mr. McKinnon.
And I will be taking Mr. McKinnon's spot for as he asked me, Mr. Chair. So we didn't get the chance to communicate that. Minister, I want to go back to the relationship between the province and the federal government, and how are you getting that particular information to the numbers with regards to the protection, personal protection equipment? How do you get all those numbers and distribute that to different areas of Canada when a certain province requests that? Can you explain to this community how is that done? How many calls do you have per week with your provincial counterparts?
Well, thank you. And I think it's not just me, it's multiple levels of communication with the provinces and territories that allow us to have a very quick line of sight in terms of what their needs might be and what concerns they have in terms of their own particular epidemiology. Dr. Tam, as you know, meets with the public health officers at least once or twice a week, maybe even more frequently. I'm looking at her, but I know it's a lot. 3 times a week. I have been having twice weekly calls with my counterparts. I think this week we've had 1 call. I know that President Namasnyaski connects as well, provincially and territorially. So does Deputy Lucas. And through all of those conversations, and each with a specific purpose, we have an ability to gain information very quickly about what needs might be arising from a variety of different perspectives. In terms of equipment, though, there are also formal requests that come forward in addition to the allotment of sharing that we've agreed upon that might indicate that a province or territory has extraordinary needs, and then we are able to fill those very quickly.
Thank you, Minister. And I have to say, tell a story locally. It's amazing the amount of Canadians who've stepped up to either produce non-medical masks, and I've have a lot of constituents who are producing non-medical masks for patients at OGGO, and they've been providing on a daily basis hundreds and hundreds of masks, and those are people sewing those masks at home. And you've mentioned the Chief Public Health Officer who is with us today, and I'm just wondering, as provinces are starting to reopen their economies, what would be the best public health advice that you can give to individuals as provinces start to reopen their economies?
Yes, so this is Teresa Tam. I think the tried and true public health measures still remains that as much as you can maintain that physical distancing, hand washing, covering your cough, staying home if you're sick. That's very important. Together with all the provincial, territorial chief medical officers, we've come to a consensus, really, recommendation, which is that the non-medical mask or face covering will provide an added layer of protection for you to protect others, or for others who are wearing it to protect you against these respiratory droplets for instances where you can't maintain that 2-meter distance, or where you can't anticipate whether you can maintain that distance. So in particular, that would apply to like public transport or going to, a grocery store or situations like that. But certainly the concept of I protect you and you protect me. And the individual provinces and territories, though, do issue their own specific advice to the citizens based on the disease activity in the area.
Thank you very much, Mr. Chair. I will end my questioning here. Thank you.
Thank you very much. We will now go to our 2.5 minutes of intervention, starting with Monsieur Bassirou Duval. Monsieur Bassirou Duval.
Oui, merci beaucoup.
Yes, thank you, Mr. Chair. The questions that were asked earlier by one of my colleagues in relation to these supposedly medicalized masks that were not really so, they were sold as medical masks. And then you had some other products that were used, Spartan products that were really not useful. We are finding this in the market. It's quite concerning. Is Health Canada really doing its job to protect the public? I have a specific case that really concerns me in terms of supply and qualification or certification for medical equipment. It's a software. It's from before the COVID era, but you can see it's quite concerning. They could get public contracts when they did not have any medical device licenses. This company is called SSC Soft Computer, and it's illegal to sell medical devices without having licenses. So what's the government doing to make sure that people are in compliance? What the consequences of people that are found in these situations? I'm just trying to understand how such an event could occur in Canada. Have there been any repercussions?
As I noted, Health Canada grants regulatory approval for medical devices as well as pharmaceutical products and other health products. In doing that, they're subject to certain conditions. If we find evidence that either those approved products or products that are on the market without approval, we take immediate compliance and enforcement information, following up to, as appropriate, remove them from the market, ensure they're being used in accordance to the regulatory authorization. If there's non-compliance, we refer it to law enforcement officers for appropriate action. In some of the specific examples given, we authorize, for example, the Spartan point-of-care diagnostic test kit that was subject to further clinical evaluation.
Désolé de vous interrompre, c'est parce que j'ai pas...
Thanks. I have to interrupt you. I don't have too much time, but I think it's important to protect the public.
I'm sorry to say that. But again, for the umpteenth time, if witnesses have not been able to complete their full answers because of time constraints, please do so as quickly as possible in writing to our clerk. Now, our final 2.5-minute intervention will be with Mr. Green. Mr. Green, the floor is yours.
Thank you, Mr. Chair. Through you to Dr. Tam. In 2006, you co-authored a report on pandemic preparedness in Canada called the Canadian Pandemic Influenza Plan for the Health Sector. The document called for the Canadian government to make plans to ensure a consistent 16-week supply, which would be 2 pandemic waves of 8 weeks, of personal protective equipment, such as the N95 respirator masks, gowns, gloves, face shields, because there would be shortages of materials and supplies during a pandemic period. Yet, according to PHAC whistleblowers on February 12, 2020, the NEST included only 94,000 surgical masks, 100,000 N95 respirator masks, 400,000 face shields, 500,000 gowns, and 2 million gloves. This would be the equivalent of 1 week of use in Ontario in April. As the public health officer of Canada, why did the Public Health Agency of Canada fail to ensure that Canada had a consistent 16-week supply of personal protective equipment prior to the outbreak of COVID-19?
So that the plan that you refer to is the Canadian Pandemic Influenza Plan, which is a guidance document. It is a broad national plan, and the guidance was to ask all levels of government, in considering a pandemic, that 16 weeks was an appropriate sort of time frame to plan for, because you could have more than one wave as well. So that is not just applicable to the federal government, but also to the health system more broadly as a recommendation for the benchmark. So I think that speaks to the health system as a whole in terms of the PPE. Now, the different roles and responsibilities, of course, of federal and provincial territorial governments. And that was the recommendation at the time. And as I say, this is an unprecedented global crisis. And we could all, not just
Thank you,
the federal stockpile, but the provincial one.
I need to ask you this last question, Dr. Tam.
Yeah.
Did you warn the federal cabinet at any time in the last decade that the NEST was not funded or mandated to amass sufficient levels of medical supplies and equipment in a response to a pandemic like COVID-19?
And if you could give a yes or no answer to that, Dr. Tam, I would appreciate it.
Actually, I'll answer that because the conversations at cabinet are private, as the member knows.
Thank you very much. That will conclude our round of questioning. Thank you, Minister, to you and your officials for being here today. I do appreciate it. I know you're under a tremendous amount of stress with the time that you're putting in on this, so we appreciate any time you could give us, and you will undoubtedly be asked back again if we feel that there are more questions this committee needs. Now, committee members, we will suspend for just 2 or 3 minutes while
Point of order, Mr. Chair.
Certainly, Mrs. Block.
I am just wondering, what is the process that a member initiates when a witness has misled the committee?
Mrs. Block, I will have to say that that is something that we can discuss offline, but the purposes of this committee, of course, are merely to bring witnesses forward to provide testimony. If you are doubting the veracity of some of the comments or some of the questions or answers, that is certainly within your purview to question. But this committee does not have the ability, at least in this format, to determine whether or not an answer that has been provided is true or not.
What if an answer that has been provided is in direct opposition to an answer that was provided to this committee 1 week ago?
Well, then you can make that point, Mrs. Block, but at this point in time, that's all you would be able to do, is bring that forward as an example.
Okay, then can I do that during this point of order?
If you can do it quickly, Mrs. Block, certainly.
Absolutely.
Point of order, Mr. Chair. I don't see what the relevance is. There's going to be a debate on this particular issue. I mean, if we want to go back and raise some issues that the opposition has also raised that is falsely claimed, we can do that as well. But I mean, I don't see the value. I don't think that's a valid point of order. There are steps that Ms. Block can take to raise the.
Mr. Duran,
well, thank you very much, Mr. Duran, but you are not the chair.
Mrs. Block.
So whether or not you believe it's a point of order or not does not matter.
Block, thank you, Mrs. Block, for assisting the chair. I was about to say to Mr. Duran, I will, as chair, determine whether or not the point of order is relevant or not, but I have to hear the point of order first. Mrs. Block, go ahead.
Thank you very much. It's why I asked whether or not it was appropriate to raise a point of order. Last week, in response to Ms. May's question to Sally Thornton, which directly questioned her about decisions to close so many warehouses that occurred back in 2012. She asked, was this associated with any budget cuts to the Public Health Agency of Canada? What drove a decision to shut down warehouses in locations you're not able to disclose? And Miss Sally Thornton actually answered, it was not actually related to a specific budget cut, but we do look at ongoing optimization. Our goal in situating where and how many warehouses we have first is driven by being able to reach all the communities in Canada within 24 hours. A lot had changed since our initial structure for those 9 cities. The transportation, the air, rail, and trucking changed. So we were able to have the same reach with facilities in 6 cities. Closing down the warehouses was just dependent on how much space we needed and where they were, but no, it was not driven by a specific cut. That is not what we heard from the minister today. And I'm just wanting to raise that as a point of order.
Well, thank you for that, your submission, Mrs. Block. The chair will take that under advisement and come back to this committee with any information or any instructions on how to proceed. Thank you for that. Minister, once again, thank you and your officials. We will suspend for a couple of minutes while we prepare for our next witnesses. We are suspended. And since we are taking 15 minutes at the conclusion of this meeting for some committee business, I will ask that we have 5-minute, 4-minute, and 2-minute interventions in that order. And first up, with a 5-minute intervention, we have Mr. McCauley.
The witness has planned to make a 5-minute opening statement, Mr. Chair.
Oh, I'm sorry, you're right. And my apologies, Ms. Simpson. You have 5 minutes for your opening statement. Please proceed.
Thank you, Mr. Chair, and to all the members of the committee for giving us the opportunity to present the point of view of our members in these extraordinary and worrisome times. I first want to acknowledge I'm speaking to you today from unceded Anishinaabe territory. Let me start by presenting who we are. The Canadian Union of Postal Workers represents 50,000 workers across every region of our country. The majority of our members work at Canada Post, but we also represent workers in the private sector, such as couriers, cleaners, and first responders. In short, our union represents the vital frontline workers that never stopped working when confinement orders were given. I want to salute their work, their courage, and their sense of community. It's not easy going to work when you are told a vicious virus is spreading. Also, I want to thank the public for your support. I will mostly concentrate my presentation on the issues facing our members working at Canada Post, where federal jurisdiction applies. But let's be clear, all the principles of health and safety for workers should apply to all workplaces, no matter the jurisdiction. Our members are worried about contracting the virus at work, and the anxiety levels rise when you don't know if you'll be put your own family in danger when you return home. We must not treat our frontline workers as though they are expendable. This is not theory. Up until now, we have been made aware of 73 COVID-19 positive cases at Canada Post. The number of CUPW members testing positive for COVID-19 is on the rise. However, our union is encountering barriers in our ability to protect these workers. And that brings me to our first issue. Our union has a responsibility to our members and a part to play in ensuring their safety at work. We have negotiated provisions in our collective agreements, and there are labor laws that require Canada Post Corporation to fully involve the union's health and safety representatives from beginning to end and comprehensively when there's a health and safety hazard present. This is the only way we can assure our members that appropriate measures have been taken to protect them. We have local joint health and safety committees and a national joint health and safety committee. Involvement and inclusion of these committees on public health agency methods, investigations, recommendations, and resolutions have been very uneven from one jurisdiction to another. In some cases, Canada Post and the Public Health Agency don't properly or promptly inform or consult with our joint committees. Documentation from public health that should be shared with the joint committees is not always shared. In some cases, we don't know whether such documentation even exists or has been provided in writing to Canada Post Corporation. Our issue is a combination of Canada Post not doing enough and public health authorities not doing enough. We know we have a productive part to play in saving lives within our membership and beyond. The government must make sure that the Public Health Agency of Canada collaborates with the provincial public health agencies when intervening in a case of COVID-19 in the workplace, to include health and safety representatives from the unions. Further, we urge the federal government to instruct Canada Post Corporation to be inclusive and transparent with joint health and safety committees because lives are on the line. The second issue I want to raise is the availability of personal protective equipment. At the beginning of the crisis, our members struggled to access PPEs they needed. We understand it was a struggle for everybody, but we had to push management to make sure our members were protected. The situation is better now than it was before, but to this day, we do not know if the inventory is enough to keep us going. As an example, Canada Post is now providing masks after we had been insisting for weeks, but management is bypassing our health and safety committees to prioritize their distribution. For all PPEs, we want to make sure our members are a priority in procurement plans for the government. We know that we are in unprecedented times. Our central point is to make sure our workers are involved at every step in the decision making. They are at the front lines. They deserve nothing less. In conclusion, governments and elected officials have to learn and continue to learn from this crisis. One thing is evident, the state has a strategic role to play. Canada Post is a vital public service with infrastructure present in every community. CUPW for years has been promoting a diversified role for the post office to better serve our communities and be central in reducing greenhouse emissions. We can use this public infrastructure like other countries to provide check-ins for seniors, postal banking services for underserved communities, and electrifying the Canada Post fleet. We call our plan Delivering Community Power. It needs to be part of your discussion as we reopen economic activities. Thank you. Merci.
Thank you very much. We'll now go to 5-minute interventions, starting with Mr. McCauley.
Thanks. I don't know if I've got a full 5 minutes, but thanks for appearing today, Ms. Simpson. A couple of quick questions. You said there were 67 identified workers with COVID. Did I hear that right?
No, there's a 73 in total throughout Canada Post.
73. Do you know how many are traceable to actual work site, or is it possible from household or other contact? Do we know that?
We've been advised that all the cases are from outside, from household, not from within a Canada Post.
Oh, okay. So they're not from within. Okay, so they have been providing a safe work environment and have adjusted for COVID if none of it has been contracted at work. That's wonderful news. You did mention, though, it's on the rise. What numbers, when you say infection is on the rise with workers, was it 50 last week? Like, can you give me an idea what you mean by on the rise?
Well, it has increased throughout the time because first we had 0, of course, and then we had 3 or 4, and then it went to 53 and then 73. So it's been rising steadily throughout the time since the COVID-19 pandemic has been declared.
Okay, but not from at work. When you talk about PPE, is that mostly required for the, like, we've got a large distribution plant in West Edmonton in my riding. Is it mostly for the inside workers that you're looking for the PPE, or just walk me through who is or where is it best deployed, inside, or is it the door-to-door gentlemen? Is it ladies as well? Is it the Purolator workers? Like, where are you trying to get it to, or where's it best focused? If you could just fill me in.
Thank you for your question. We want PPEs for all the CUPW members. Those would be the retail counters, those working inside, the letter carriers, the RSMCs who are outside delivering mail door to door, as well as the community mail boxes.
Okay, so for everyone.
Everybody needs PPEs.
Yeah, is there a priority? Like, is it the inside workers would be top priority, or is it just across the board? Like, I'm thinking risk-wise. Risk-wise, I'm just thinking, who do you think is highest?
Everybody's at risk of COVID-19 because we don't know where you can catch it or how you can catch it. So everybody should be supplied with PPEs.
Yep, no, that's a fair answer. I'm just trying to educate myself. That's all I have for questions. Thanks very much.
Thank you for your questions.
Thanks.
Thank you very much. We will now go to Mr. Jahari for 5 minutes, please. Oh, I'm sorry, Mr. Kuzmierczak for 5 minutes.
Thank you very much, Chair, and thank you very much, Ms. Simpson, for your testimony. And I just wanted to say thank you for the tremendous and dedicated work of our postal workers, especially during these trying times. Not only do they deliver mail and parcels, but they also deliver that invaluable social connection and that social contact as well. And I know for a lot of communities, it provides a reassurance and also provides an opportunity for a check-in as well too, for some, especially for some of the seniors and some of the folks that are more vulnerable. So I just wanted to say thank you for all your members and all their hard work through these trying times. I just wanted to get a sense of the measures that have been taken to protect employees, whether it's at processing stations or whether it's, for example, door to door. What are some of the measures that have been taken to protect employees during this period?
Thank you for your question. You know, postal workers, we really care about our job. As you know, we've been over 2 years, both of the bargaining units without a collective agreement, a new collective agreement in place, and they're still going out every day to work and to ensure the economy is still flowing and making sure the rest of the public can also self-isolate. So we thank you for your appreciation, but, you know, we really want a collective agreement put in place for our workers. To the second part of your questions, we have what we call local joint health and safety committees and a national joint health and safety committee. We've been speaking with the Canada Post on a regular basis. But we need to also ensure deep cleaning occurs on a regular basis, as well as the PPEs I spoke about earlier on. And we would also ask the public to, for example, to keep the distance from our members as they deliver their mail to their homes, also wiping down their mailboxes, leaving the mailboxes open, wiping down your CMB, your community mailbox, if you do have a community mailbox as well. And also we've asked for staggered shifts to occur at the plant so we can have social distancing within the four walls of the facilities. And at the retail counters up until Tuesday, they had different hours, but now they've gone back to the regular hours. That would have given the time for the workers there to have cleaned up their workspaces a bit better.
Okay, thank you very much for that. And what types of, are there signatures that are still required, for example, on parcels when they're being delivered, or are there other measures that were introduced, for example, as the employees are delivering the mail?
We've modified, some of the measures have been modified through consultation with the union to help us not have to be in such contact with the public as we deliver the mail to the door-to-door delivery, as well as to the community mailboxes. So the pickup is happening now with at the retail counters, and that, as I mentioned earlier on, they've gone back to the regular hours of operation. So we have to look at trying to get better measures in place. We have the plexiglass up right now. We need to get a bit of a thicker one, because the one that was put up originally, we felt is not really enough for our workers at the front counter to feel safe, as well as possibly getting face shields, as well as the face masks for those. And also the hand sanitizers and wipes we made available, and to stagger the number of people who come into the store at the same time.
Gotcha.
Ms. Simpson, excuse me for my intervention, Mr. Kazmierczak. Ms. Simpson, you would be helping our interpreters greatly if you could hold the microphone closer to your mouth when you're responding.
Okay.
Thank you so much.
You're welcome.
Oh, thank you. Mr. Kazmierczak, please.
Yeah, thank you very much, Chair. And Ms. Simpson, I know that you've been dealing with sort of two big issues simultaneously. One is that there's been a significant increase in parcels that are being delivered, and at the same time you're dealing with these COVID restrictions that are being put in place and COVID safety measures put in place. Can you sort of talk about how the impact of, again, increased volume, parcel volumes, increased demand, plus the restrictions as well too? What impact is that having on employees and perhaps delivery times as well too?
As we discussed during negotiations before, health and safety has always been a concern for the workers. And now with the increased volumes, so they're almost like Christmas volumes and even beyond. So unfortunately, with the COVID-19, we haven't been able to hire many temporary workers because they need to be trained. So, a lot of temporary workers have been temporary workers for years, and they need to be made permanent either in full-time or part-time positions to help to alleviate some of the stress on the workers doing the extra overtime, because people need breaks on the weekends as well to try and rejuvenate themselves for the rest of the work week.
Understand. And I know that some of your workers as well are couriers, they're drivers, they're vehicle mechanics, warehouse workers for other private sector companies as well, not just Canada Post. Can you talk a little bit about what safety measures we have or are in place for those employees and how they compare to the safety measures for Canada Post and Pure Later employees?
And Ms. Simpson, unfortunately, we're out of time, but as I have advised other witnesses before this committee, if you could provide a fulsome answer to Mr. Kazmierczak's question in writing to our clerk as soon as possible, that would be greatly appreciated. We'll now go to Madame Vignola. 5 minutes, s'il vous plaît.
5 minutes, please. Thank you very much. Mrs. Simpson, I have also a few questions, of course. As far as safety measures are concerned, I understand that your employees are serious people. They want to ensure their own safety and the safety of their clients and family. But are those rules applied everywhere, even in the private offices like in pharmacies? Thank you for your question.
Those workers are not our members. Everybody has a right to feel safe at work. And no matter what the jurisdiction is, with the COVID-19 happening right now, the PPEs should be supplied to those people working at the Shoppers Drug Mart and the private counters that you spoke about earlier on.
Okay, merci.
Thank you. on May the 5th, an article was published according to which Amazon did not inform its employees in Brampton that a COVID case was declared among those employees. So I would like to know if Canada Post employees have direct contact with Amazon warehouses employees, and if so, what are the safety measures put in place to make sure that nobody gets contaminated, given the ordinary measures taken by Amazon concerning those point systems?
Amazon treats their warehouse workers, not respecting the COVID-19 process. You know, as soon as somebody is COVID positive, they should notify those working within and do a proper trace to notify those who could possibly have been in contact. And you know, we're disappointed to see the government had given them this contract, knowing that they had this very bad record of how they treat workers. Currently, I don't think our members are in contact with the Amazon workers, but I can get back to you with a definite answer later on. But thank you again for your question.
Merci.
Thank you. Is there a good communication, at least, between the Amazon warehouses and your employees regarding the declared cases?
Contact with the warehouses, so I'm not too sure if there's communication. People may know them in their own personal life, but on a business level, we don't have contact with the Amazon workers on a daily basis as such.
D'accord.
Thank you. And Canada Post has a website, and from what I understand, it's the Amazon platform that's used for distribution. Was the Canada Post platform not able to do what Amazon is doing, or is it a free choice that was made by the government? What is your vision about this as a union? Would it have been possible for Canada Post to ensure all those services?
So we spoke to, as well as the Canada Post representative, that the piece of the contract that was given to Amazon could not have been done by CUPW members. But again, I want to reiterate, you know, we're disappointed that the government awarded this multi-million-dollar contract to a company that has a bad history across the world of not treating their workers properly. You know, to reward this kind of financial reward to this company is unacceptable, and we really have to make a better choice when we look at providing contracts where workers' rights are respected and health and safety is also respected.
Merci. On le veut aussi.
Thank you. That's what we want too. According to Ernst & Young, the present Canada Post model is not viable without an increase of revenues or a decrease in costs. Before 2026, there would be annual losses of more than $700 million. I know that your union has many suggestions that were made to the government regarding revenues and services offered by Canada Post. So do you believe that those suggestions can really mean that we can have a better service, a faster service, and a service at reduced cost?
Again, Ms. Simpson, I would ask that if you could provide an answer to that question in writing and as quickly as possible to our clerk. We'll now go to another 5-minute round of questioning with Mr. Green.
Thank you very much, Mr. Chair. And I do have to go on the record and say I'm a bit disappointed that we didn't have Canada Post before us today and we didn't have Amazon before us today, but I do deeply appreciate Ms. Simpson for being here representing her incredible union of postal workers. On May 1st, 2020, the Canadian Union of Postal Workers issued a news release criticizing the pace at which Canada Post took measures to protect employees, including the time it took to provide workers with PPE. The same news release criticized the quality of the masks that were provided to workers. What is your assessment of Canada Post's communication and implementation of employee safety measures and leave provisions?
Well, thank you for your question, Mr. Green. And I too, and I knew we're disappointed Canada Post as well as Amazon are not here as well. So looking forward to hearing their point of view on the different issues. So in regards to the PPEs, you know, they were slow in coming. And it's only, I think last week we learned that Canada Post was going to ordering the masks for all the employees. We think, you know, you need to be proactive, not reactive. Even though Theresa Tam didn't say we needed masks for all employees, the employees were asking for that, as well as the procurement of hand sanitizers, wipes, face masks, face shields, and even the protective shields that went up at the retail counters. As a big company serving the public on a regular basis, the workers know what they need. And by speaking to the local Joint Health and Safety Committee, they would have heard these things and been able to order the procurement of items earlier on. We asked the government to also put Canada Post on their procurement list to prioritize Canada Post as a company that would receive the PPEs in a timely manner. We don't know how long COVID-19 would go on for and how long we need to have the PPEs in place, but we need it once more to be proactive and have them in place and not be scrambling at the last minute to get these items for the workers. We want to make sure the workers are safe who go to work, and the ones who need to be home on any kind of leave are fully receiving financial help for staying home.
Can you give us an example of the consequences for workers that have poor cooperation with the public health authorities?
Well, you know, a lot of times with misinformation, we're all learning from this COVID or together. We don't know what the outcome is or what it is. We're learning every day new items, and people have anxiety. They're out there every day dealing with the public, and they don't know what the reality is or what their health and safety is. As we get more information, it needs to be shared in a timely manner and have joint meetings with our committees so they can share the information with the members in a timely fashion, so everybody's on the same page and understands the risks that they feel. You know, like the reality of working in a plant versus working on the street are very different for each worker.
So how would you rate your satisfaction of Canada Post's response to your workforce? Are you satisfied with their response?
You know, it could get better. We know at different levels, there's different communications that are happening, but we need to have the local joint health and safety committees who are actually on the work floor with the workers. That's where the communication has to happen first, because those are the workers who are on the front line. And if they're scared and they need PPEs or they have uncertain questions that need to be answered, they need to be answered as soon as possible to try to alleviate the fear with the workers that's happening on the work floor.
You had mentioned that there may not have been an overlap between Amazon's responsibilities and what you're providing as your frontline workers. Do you believe that there is growth and room within Canada Post to be able to have a comprehensive logistics system that would safeguard the distribution of our critical PPEs throughout all levels of government and health agencies across Canada?
I feel there's always an opportunity for Canada Post to expand the services which they offer, and that's why we have Delivering Community Power, which talks about expansion of services. And as we reopen the economy, we need to look at how we can expand and make Canada Post, you know, a community hub, because in some locations, it's the only federal building that's in a community. So therefore, I think it can do different jobs and different services.
And I will probably take up that line of questioning. Is this a 5-minute round or a 6-minute round? This is a 5-minute round, correct?
5-minute round. You've got a little less than a minute.
Okay, I just want to go ahead and appreciate you for being here. And in my second round, I'll start fresh with that line of questioning on delivering community power. Thank you, Mr. Chair.
Thank you. We'll now go to the second round of 4-minute questions, starting with Mr. McCauley.
Great, thanks. Just have a real quick question or just a real quick comment. I just want to thank, you know, it's remarkable. Canada Post, 60,000 employees, a lot indoors in large, but also very worker intensive situations, not a single COVID case traced back to Canada Post. So I want to say thanks to both sides, the management of Canada Post, for delivering what has turned out to be a great, safe workplace, but also CUPW for working with Canada Post to look after all the workers. I just want to say thanks to both sides. It's remarkable, not a single COVID case traced back to the workplace, despite 60,000 workers. So thanks to both sides. That's all I have to offer.
Yeah, well, at this time, there's no tracing back to the workplace. So yes, we're very happy that our workers are being safe, but we also want to ensure that it stays that way by having open communication and having the local joint health and safety committees involved in every aspect.
That's what I was saying. It looks like both sides are doing a wonderful job. So again, thanks to both sides. A remarkable story.
Thank you, Mr. McCauley. We'll now go then to Mr. Johari for 4 minutes, please.
Actually, it will. I'm going to take over if I can for Mr. Chair for Mr. Johari.
Well, are you asking my permission, Steve? I'm not sure, but yes.
I defer the chair to you, Mr. Chair.
Kidding, of course.
Always.
Please go ahead, Steve. You've got 4 minutes.
Donc, je change en français. Donc.
So I will speak French. So thank you, Madam Chair, for being here. I know a lot of your brothers and sisters and people from the union who work here in Gatineau for having visited the distribution center and for having met them in my daily life. So I would like to thank all those who work every day to deliver our mail and parcels. So thank you very much. Bon,
perhaps not scoop you, Madam President, but do want to point out that the attendance of your members, their devotion to the job, their ability, I think, to deliver what would be a record number of parcels through a very difficult period, but a period obviously where Canadians are depending on that distribution is truly remarkable. And I want through you to convey our appreciation for the work of CUPW, and maybe let you comment on perhaps the high volumes that you're dealing with.
Merci pour votre question aussi. So, again, like I said before, our members are over 2 years without a new contract for the rural suburban mail carriers as well as the urban workers, and they still go to work every day and ensure that the public can stay home and the economy can keep growing and we can flatten the curve. Our members go to work, but they need to be safe when they go to work so they can return home to their families safe as well. They are part of the community. And they love the job they do, but they need to be safe, as I said before. And hopefully, we'll have a contract in place soon, because the last 2 rounds, they've taken away our right to strike during these 2 rounds of bargaining, and the workers are still on the front line working, because that's how important to us, keeping the economy going.
Well, I do want to just in addition to all that, point out that, not in addition to COVID, we had the floods in Fort McMurray, where I believe, other than a brief interruption, the mail got through, and just a real tribute to the men and the women of Canada Post and CUPW, who are devoting themselves to this. For once, I'll agree with Mr. McCauley, perhaps, and say that it's been a remarkable achievement that we've been able to, in what is a high volume period, in some very large and sophisticated distribution hubs, to be able to stay COVID-free, at least as far as we know, in the workplace. So thank you for that as well.
We have to thank the local joint health and safety committees, because they're there as soon as the case is pointed out. Right away, they ask for the cleaning, the deep cleaning to occur. They inform the members of what happens, and they're able to to trace what has happened. The public health authority, their process isn't the best. It's not very inclusive. I feel they need to improve and have maybe a 3-way call with Canada Post as well as our members, so they're involved from the very beginning of the process. And also they need to have come into the workplace. A lot of it's only done over the telephone, and that's not acceptable. You need to come into the workplace, talk to the members that are actually affected, and also give a proper written information of what's happening and how the COVID case is being handled. Even though we're a federally jurisdicted company, each province has their own practice, and they're very different in each province. We need to have a unified practice across the country that can give some security and stability whenever there's a COVID-19 case within a workplace.
Well, I know like a lot. Oh, am I out of time, Mr. Chair?
You are completely out of time, Mr. McKinnon. We'll now go to Mr. Boulte for 4 minutes, please.
Yes, thank you for appearing today. And the question is, according to guidance from PHAC and the World Health Organization, cited on Canada Post website, quote, because of poor survival of coronavirus on surfaces, there is a low risk of spread from products or packaging shipped over a period of days or weeks. Currently, there is no evidence of COVID-19 being transmitted by imported goods or packages. The question do you agree with this assessment?
Well, I don't know. I'm not a scientist, but this is what we've been told. So I'm following what's being said. So in our opinion, we've asked the public to wipe down the doorknobs, the stair rails, their mailboxes, and possibly leave their packages outside for an extra day to ensure that there's no possible tracing of COVID within any kind of packages which they receive at their home. But even if you go grocery shopping and go to any store, this should be done as well. Anything that comes into your home from outside should be wiped down to be extra careful, because we cannot guarantee that COVID cannot be transmitted from anywhere.
But that quote is on Canada Post website. So
yeah,
the question is, do you agree with that assessment? Yes or no?
I don't agree, because at this time, that's what we have, but it's a quote. I don't know. I haven't seen all the information to verify that. So at this time, it's a quote.
So yes, there is a quote, but that's now on an official website of Canada Post, and basically you represent the union of Canada Post workers. So if you disagree with it, that kind of statement could carry a risk for the people employed by Canada Post, whether in warehouses or outside. And this is what I like you to clarify that, because I think it's very important to pay attention to such a statement, because I'm sure workers of Canada Post and your members will be reading this statement, and they may work with it.
Like you said, it's on Canada Post website, it's not on our website. So for us at this time, as we know, the COVID-19 information is changing as we go along. So therefore, as hopefully they'll update their website as new information comes along. Like I said earlier on, at this time, there's been no cases within the four walls through our packages, but we never know what could happen later on. But we're hoping that it will stay the same to ensure that our workers and the public are safe. But you also have to take some security on your own side and make sure you wipe down the packages that come to your home to ensure that there's nothing on the packages, whether it's from Canada Post or from the stores which you shop at with your families.
So for the last 10 weeks, do you recall that packages like this coming from overseas or big boxes are being traced back to be a cause of COVID-19 cases among the Canada Post workers?
Not at this time. Like Canada Post, anything coming from the U.S. is held outside for an extra 24 hours before it comes into the facility to be sorted to ensure that there's no virus.
And what that does to the safety of having anything on those boxes, like any symptoms or basically any risk.
According to the information that's been provided by the World Health Organization and the quote that you read off a Canada Post site, it allegedly stops any kind of spreading of the virus within a package.
So as a union, you monitor these circumstances closely, and do you have your own instructions over that?
At this time,
a very, very brief answer, please.
At this time, we're following what's being said, but like I said to you before, we have to ensure that all the packages are held safely. We have wipes for our workers, as well as hand sanitizers, to make sure that they have no opportunity to catch COVID while they're at the workplace.
Thank you.
Thank you very much. We'll now go to Mr. Weiler for 4 minutes, please.
Thank you, Mr. Chair, and I'll be ceding my time today to Ms. May.
I am so grateful, and thank you, Chair, and thank you to our witness from the Canadian Union of Postal Workers. And I also want to extend my appreciation through you to all the workers at CUPW who've been continuing to work in these very trying times. And I agree with the comments earlier from my friend Kelly McCauley that a lot of credit is due to everyone involved. But I wanted to pursue a point you made about the reality that on the ground, every community has a post office and every community has CUPW workers, and your eyes and ears on the ground. Correct me if I'm wrong, but I know there's been a lot of very innovative proposals coming from CUPW for how we could make Canada Post sustainable for the long term. Things like pursuing postal banking, as is done in many countries around the world. And I was wondering if you had included in that, because part of we included it in a Green Party platform proposal for the future of our post offices, and I think we got the idea from CUPW. So correct me if I'm wrong. What kind of capacity long-term in a pandemic, in a national emergency, what kind of additional services does CUPW think we could rely on these, essentially these small federal hubs, some large, in every community across Canada? Is there a long-term lesson post-pandemic about how our postal offices can become hubs of PPE distribution, information, checking up on people who are vulnerable, that kind of range of thinking outside the box about what we usually think Canada Post delivers?
Thank you very much for your question. For us, we think it could be a community hub where there's one-stop shopping, for example. So you could know, right now we offer, student loan services, we offer some fishing licenses and that, but as well with the pandemic currently, a lot of the banks are closed. So if we had postal banking, which we had until 1968, you're able to come in there, do your banking, purchase your stamps. And a lot of places too don't have the community broadband. You can have broadband access to internet services while you're at the post office as well as having charging stations there. So you can charge electric vehicles if you do have an electric vehicle. And for the senior check-in services, we do what we call the last mile. So with the last mile, you're able to go to everybody's door, where other companies like Purelator and those could not go to. You can make sure seniors are at home safe and sound during the pandemic, delivery of medication, that too as well. It's an opportunity for Canada Post during post-COVID to look and reanalyze what opportunities were missed at offering services at the retail counters, as well as the letter carriers who go to door or do community mailbox deliveries, as well as the RSMCs who deliver in the rural areas as well.
We've had changes made to Canada Post, of course, and in a lot of the more rural areas, we've seen the construction of bulk community post boxes as opposed to door-to-door delivery. Do you have the information on the tip of your tongue, or can you send it to us in terms of what proportion of Canadians still receive door-to-door mail delivery? Because I'm asking in light of post-pandemic, we know that keeping track of people in their homes becomes particularly important when people are locked down. And I think certainly one of my colleagues mentioned this earlier, the social contact offered by, forgive me, our posties. What proportion of Canadians still get home delivery of their mail?
I don't have the number right at hand, but I will definitely get it back to you within a timely manner so you'll have the exact numbers. But, we feel that every home should have door-to-door delivery if they require it. And we're disappointed when we saw the community mailboxes go into areas. We really want to get back to having door-to-door delivery for all Canadians across the country.
Thank you very much.
Thank you, Mr. Wheeler, and thank you.
Thank you, Ms. May. We'll now go to our final two interventions of 2 minutes each. Monsieur Bossou-Duval.
Merci. Thank you, Mr. Chair. I've heard a lot that postal workers have a lot of work to do. There was as much to do as during the holidays, for example. So with such a high volume of work and the situation with COVID-19, we have all kinds of concerns and additional measures that need to be taken to ensure the safety of people working on the front lines that communities need. Are there any accommodation measures that have been put in place to ensure that there's a certain balance so that people can get a bit of a break?
Yeah, like I said before, they're offering a lot of overtime because, unfortunately, we don't have a contract still in place for over 2 years for both of the bargaining units that I mentioned earlier on. So therefore, we could have fixed some of the problems of overburdening if we'd finished the negotiations before the pandemic hit. But currently, with the pandemic in place, a lot of the workers are getting overtime to take the parcels out. But we also have to put measures in place where people are not overexerting themselves and exhausted doing the work as well. So therefore, the temporary workers have been coming in to help out, and overtime being offered to those who want the overtime.
Est-ce que les travailleurs temporaires do temporary workers, are there enough of them? Do you know if is Canada Post looking at calling back certain retirees who could help out perhaps?
And a very brief answer as well, please.
No, we're not looking at calling back retirees. They would have to reapply to be rehired to be a postal worker again. But currently, there are temporary workers, and they need to be trained to work with social distancing that needs to be in place to ensure the training is proper. And a lot of times when we train, we do train like where you shadow another letter carrier on the route or an RSMC on the route. So we have to ensure that social distancing and those provisions are in place. But as like I said before, we need to hire more workers at a higher start wage as well to keep people at Canada Post working for a long time.
Thank you very much. Our final 2-minute intervention will go back to Mr. Green.
Thank you very much, Mr. Chair. And again, I want to share my dismay that we didn't have Amazon here. And I say that because my fear, through you, Mr. Chair, to Ms. Simpson, is that given her recent understanding that they need to have higher pay for this work, given the fact that we now have Amazon in the mix, is there a concern out of your union that there could be calls for potential increased transfer of your work towards lower income, lower labor protection companies like Amazon, given that you don't have a contract? That's really what I stumbled on.
Yeah, no, unfortunately right now, Canada Post is not really it's not staffing it's not doing the transfers right now. We have what we call a transfer. So you can transfer from one location to another location. And through collective bargaining, we're able to ensure that the work stays within our CUPW members through a consultation. So therefore, for us, we have to ensure that, even if people work at Amazon and that, they need to be organized into a union. And this is what's important because every worker has a right to join a union and they need to join a union. And we even saw the vice president of Amazon quit there because he saw how badly the workers at Amazon are being treated. So that should speak volumes.
Oh, I'm not sure if I froze or if she froze.
I think Ms. Simpson has frozen.
Well, I kind of froze on the question a little bit, so that's all fair game. I do hope that we have at a future date the vice president of Amazon here before us. I do hope that we have at a future date Canada Post. I'm still unsure and a little bit disappointed that they're not here before us today. And hopefully I can pick up some of that line of questioning directly in terms of future prospects for increased privatization. Mr. Chair, I'll say in my final 30 seconds that back in 2016, as you know, as a young city councilor, I was before this very committee to provide testimony on the need for postal banking. That was a call that I think would provide significant revenues to Canada Post. It's a call that we've had most recently from our MP, Nikki Ashton, that there are viable ways in which we can use the fact that there are more post office outlets across Canada than there are Tim Hortons. So with that, I will conclude my remarks and thank Ms. Simpson for being before us here today, even if she can't get online. Thank you.
Thank you very much. And Ms. Simpson, I'm not sure if you can hear me now or not, but if you can, I want to thank you for your appearance here today. And I want to thank all committee members for staying within our guidelines for time allocation for the questions. Ms. Simpson, you are excused. And now, colleagues, I will not need to suspend. We can directly go into committee business. I want to go over a couple of points first. Number one, you have all received by now an updated work plan that our analyst would have emailed to you just prior to the start of this meeting. I'm not sure if you've had a chance to go over it or not, but if you can, I would suggest you try and scan that as quickly as possible because we want to discuss potential future witnesses who you may wish to bring before our committee. Secondly, I'm not sure what's going to happen on Monday. Monday, of course, was scheduled to be the resumption of Parliament. I have no idea whether or not it will be returning. Parliament will be returning in an abridged form, a hybrid form, or whether the current sittings of Parliament, which have been mostly virtual with a few in-person sittings, will continue. Depends on what happens on Monday. I'm anticipating, of course, there will be some and perhaps vigorous discussions about that. I'm not sure if there's going to be any motions to that effect, but currently we are under the motion that was adopted on April 11th. That expires come Monday. I mention all of this as way of background because we will have to wait to see what happens on Monday to determine how many more of these meetings we'll be having. The normal scheduled end of Parliament was June 19th. That's on the parliamentary calendar. But we don't know at this point in time whether that will still be in effect or not. So given that, I would suggest that we take a look at the schedule for the next few weeks without getting, I would suggest, onto the last scheduled day, June 19th. If we can look at meetings up until that time, perhaps even the week of June 12th, that might be the best course of action. I'd hate for us to schedule meetings and find out that Parliament has been dissolved or adjourned for the summer, if that is to be the case. Secondly, I just want to remind people, I didn't do this in my opening remarks, Monday's meeting has changed in terms of times. Normally we meet between 2 p.m., 4 p.m. Eastern Standard Time. Monday will be between 5 p.m. and 7 p.m. Eastern Standard Time. Please make sure you're aware of that and put that into your calendars. And finally, I will turn this over now to our analyst and Raphael. Perhaps if you can lead the discussion on the work plan which you have distributed. Raphael?
Yes, thank you, Mr. Chair. So as members will see, we suggest an additional 6 meetings. The first 2 have already been approved by the committee and should take place next week. Then we proposed another 4, and I'm just going to highlight the changes between version 3 and version 4 of the work plan. So for the second last meeting, which will be meeting 13th, we added officials from PSPC responsible for the administration of the Phoenix Space System as suggested by 1 member. And we also added a 14th meeting, which would be the last, with suggestions from members, as well as the 2 witnesses that were supposed to appear today from Amazon and Canada Post.
Now, colleagues, you have that revised work plan. I'll just open it up for discussion. If you can raise your hand virtually, and we'll see if we can accommodate any questions or suggestions you may have.
Mr. McKinnon.
Mr. McKinnon. Yes, please, Mr. McKinnon.
I just want to ask just a point of clarity. So the Minister of Public Services and Procurement would be asked back, and it would be explicitly to discuss the Phoenix pay system?
Yes, Raphael, go ahead. And may I remind all colleagues again of the order of reference adopted on April 11th was that this committee must restrict its study to the government's response to COVID-19. So, Raphael, perhaps given that context, you can explain what it is you would have the witnesses speak about if they're coming to talk about the Phoenix pay system, if there's a relationship between that and COVID-19.
Yes, so regarding Minister Anand, my understanding is that 1 member would like her to discuss procurement. And regarding officials from PSPC on the Phoenix space system, I'm not sure what is the relationship between like with the current study. So maybe the member who proposed that name could speak to it.
And I'm not, since I don't have that in front of me at this moment.
It was a blog, so it's Mrs. Vignola.
Madame Vignola, perhaps then you can explain your suggestion to bring someone from the Phoenix pay system and how that relates to the COVID-19 government's response.
En fait, c'était...
Well, I just wanted to understand the response to this pandemic. What's the impact on other sectors that are already struggling? That was just what I was trying to find out. If the committee believes that this is not necessary, it can be delayed for a while. I have no issue with that, but I think it's rather looking forward to having a solid plan in place.
Before I make any further comments, I see a couple of hands raised. Mr. McKinnon, I've seen yours. Mr. McCauley, had you raised your hand as well, or was I? I think Mr. McCauley is first, and then we'll go in following that.
I was just going to say we're generally fine with the plan as put forward, recognizing things may change depending on the negotiations in the House.
Mr. McKinnon.
Well, I think I don't know. I'll let Mr. Drouin comment, but I don't think we have a fundamental issue with the proposed witness list either. I would only say on the Phoenix issue that, of course, nothing prevents a member of this committee from asking any minister about any issue, really, and to draw a connection between it and the current state of affairs. So, I'm sure the minister will be happy to answer questions about Phoenix or procurement or anything else if we choose to adopt this.
I have Mrs. Block first and then Mr. Drouin.
Thank you very much, Mr. Chair. I would just add that I think this work plan looks good. Echo Mr. McKinnon's comments. I'm sure between now and the time that the minister appears before committee, perhaps Madame Vignola could determine further what kind of a question she would like to ask the minister on that. And I appreciate Mr. McKinnon's acknowledgement that she would, be more than willing to answer any questions that we may have of her. I am a little confused in regards to your opening comments and Monday's, what could be happening on Monday. Are you suggesting that we will go ahead with the plan to meet virtually on Monday as a committee, not knowing exactly what may transpire on Monday? Is that your thinking, and that potentially we suspend inviting other witnesses to virtual committee meetings, not knowing what may be decided on Monday?
No, that's not what I was suggesting at all. As I mentioned in my opening remarks, the whips have already set the schedule for next week, and we will continue with that schedule. We will also continue with the proposed work plan if that meets the approval of the committee until such time we are advised differently, if we are to be advised differently. All I'm pointing out to committee members is that on Monday, things may change and we have to be prepared for that. Mr. Drouin.
Yeah, a little bit in the same sort of questioning that Ms. Block had. I'm just wondering if and again, I don't need responses now, but if if things suddenly change on Monday and we are now back to our regular schedule and the committee will operate in a regular manner, I'm just trying to wonder at this point, is it the will of the opposition to continue with the same sort of study that we're doing on COVID-19? And if not, then I guess we'll find out next week. But I'm just trying to get a sense from Mr. Macaulay, Ms. Block, and Mr. Green and Madame Vignola, just to see if that's what they want to do for the next 3-4 weeks.
What I'm suggesting,
too early to say?
Yeah, what I'm exactly, Mr. Macaulay, I agree it's too early to say. And that's all I'm saying is that we may have to adjust our schedule. We may have to adjust the studies that this committee undertakes, depending on what happens on Monday. But in the interim, we have a work plan that's been suggested. My read of all of the commentary is that, generally speaking, people are in agreement with it. And what I would like to suggest is that if we can have a recorded vote, and if we approve the proposed work plan, we follow that until such time we don't, if that makes sense to you. So, Mr. Clerk, seeing no other hands raised, I would, Mrs. Block.
So I just want to ask, do we know, and maybe I should know the answer to this, is the House sitting on Monday in a similar form to the way it sat on April 20th when we were, when it was supposed to be that we were coming back? Do you know that?
My understanding, and I'll ask Paul for his interpretation as well, Mrs. Block, but my interpretation, or my understanding, is that the order of reference of April 11th put the temporary COVID-19 virtual parliament into place, but parliament resumes officially on Monday, May 25th. We will have to see what happens on that date. I anticipate there will be some motions brought forward, probably by the government, but that's only my opinion. But we do know that Parliament has been instructed that it will be resuming on May 25th. I anticipate we will not have a large contingent of MPs showing up for obvious reasons, but Parliament itself will resume until such time motions or orders of reference are passed to amend it. So we'll just have to wait and see, Kelly. That's all I'm saying.
So, just in response to that, given that we don't know that, we will still go ahead with the meeting at 3 p.m. Our time. We presume that whatever proceedings may be taking place in the House on that day would have come to a conclusion, and then we can go ahead and start a virtual meeting at 5 p.m. Eastern Standard Time.
Well, that's why I'm suggesting we wait and see. One of the reasons I'm sure that the meeting was scheduled for 5 p.m. as opposed to 2 p.m. is to allow the discussions to take place in Parliament. In terms of when we go or what we do from there, I'm quite assured that your whips, all 4 whips, will be in constant communication with one another, and they will be advising their members accordingly as to how we proceed. So, Paul, with that, perhaps we can ask you to take a recorded vote on the work plan as proposed. And following that, I would like to make just a couple of quick comments with response to Mrs. Block's point of order from the last round of questioning on the veracity of statements by one of our witnesses. So, Paul, please proceed.
Thank you, Mr. Chair. So the motion essentially is that the committee, for the 4 meetings following the May 29th meeting, the committee's already decided which witnesses it'll have up to May 29th. So for the 4 meetings following the May 29th meeting, they'll invite the witnesses identified on the current work plan numbered 11 through 14. So meetings 11, 12, 13, and 14. That's my understanding of the proposal. I will now do the roll call on that. Monsieur Drouin?
Oui.
Mr. Joe Howery?
Yes, agreed.
Mr. Kosmierczak?
Support.
Mr. McKinnon? Mr. McKinnon, I need you to unmute your microphone. Unfortunately, I do need to hear you.
Pardon. Oui.
Mr. Weiler?
I'm in support.
Mr. Abultiev?
Oui.
Ms. Block?
Yes.
Mr. Macaulay?
Yes.
Madame Vignola?
Oui.
Mr. Green?
Yes.
That is, Mr. Chair, 10 in favor, none against.
Thank you very much, colleagues. Finally, I just want to make a comment on Mrs. Block's intervention and point of order from earlier on. As I mentioned during my response to that point of order, I would come back to you with some instructions or advice. And since we don't know what is going to happen on Monday, my advice, Mrs. Block, is that your point of order should probably proceed through the normal channels. In other words, if you feel that the testimony presented to you and to this committee was misleading, whether it be deliberate or inadvertent, the opportunities you have to deal with that or to try and rectify that would be through the normal processes of Parliament, i.e. a point of privilege you raise with the Speaker. In terms of this committee, under the terms of reference adopted on May 11th, we are restricted to only dealing with the motion that was given to us, that is to discuss the government's response to COVID-19 and nothing else. The only exclusion or exception to that motion would be a motion determining witnesses and testimony. So your point of order is probably best served by sending it through the normal processes. And I know that your House leadership team, Mrs. Block, will be able to advise you as to the opportunities before you. But as an example, this committee would not be in a position to adopt a report that you may want to put in a form of a motion concerning testimony that was given to us by a witness.
Thank you very much, Mr. Chair. I appreciate that direction, and I will I will go back and review the evidence from today. I know that it comes in quite a timely way, and determine how I may want to proceed as a result of your advice and what I read in the testimony from today's meeting. Thank you.
And thank you all. Colleagues, seeing no other hands raised, have a good weekend, and we are adjourned. See you all Monday at 5 p.m. 5 p.m. Eastern Time.